Hi, everyone. Thank you for tuning in. I'm Alexandra, the brand educator here at MDPen. Thank you, everyone that was able to attend our webinar last night. It went amazing. And thank you so much for all your participation in the chat. So, for today, I really wanted to talk about rosacea versus acne, and in particular, papular pustule rosacea, because it can often resemble pustular papular acne. So I kind of wanted to go over a few ways you can identify the differences, things you can do to prevent one versus the other, and we'll talk about all different things with this video. Let's get right to it. Feel free to ask questions in the comments. I will try to answer them the best that I can. So acne and rosacea are definitely amongst the most common skin conditions, and they can affect just about anyone. And both can show up as this redness, inflammation, and treating them, can vary from relatively easy to definitely more difficult. Now, acne, which we know as acne vulgaris, can appear in grades 1 to 5. You have, all different types of acne occurring visually, but often what can be confused with rosacea is going to be more papules and pustules. Oh, I thought I saw a question there. Okay. So, yes, it's going to appear mostly as pustules and papules. These are the ones that can mimic rosacea here. Now, one major difference between rosacea and acne is that rosacea is typically confined to the face, only the face. So, if you are having body breakouts, this is acne or folliculitis, if it's, falling in that category there. So that's not going to be rosacea. And we know with acne, typically this is a result of your skin's oil glands, overproduction of oil, sebum, it's building up, clogging those hair follicles. And this is mixing with dead skin cells. There can be P bacteria in the skin pores that are going to lead to more inflammation and irritation. Now, like acne, rosacea again is a skin disorder only appearing on the face. It can happen on the neck and chest. This is more rare, but that's about it. Neck and chest. It's not going to be all over the body. And typically with rosacea, um, the rosacea that's going to appear to mimic acne is going to be that papular pustule rosacea. Rosacea is a long lasting skin condition, and it can definitely cycle between flare ups. It has its own triggers, just like acne. So, one of the best ways to distinguish what you have is to look at your triggers. It sounds cheesy, but you can take notes, do a journal. I woke up today with a breakout. This is what I ate before bed. This is what I've had the last 2 days. This is what I've been around. I've been outside. So these are things to think about. Common triggers with rosacea are going to be hot drinks, coffee, alcohol, tomato-based foods, yogurt, avocado, chocolate. It depends. So you need to know your particular triggers when you're trying, to figure this out. I see some things coming into the chat here. Let me take a look. Okay. I will get into skincare. Absolutely. All right. Let me get back. I'm going to get back to those questions in just a second towards skincare. We'll get to that towards the end of the video. So let's talk about this is a good one. Let's talk about what age do acne and rosacea typically occur. So with rosacea, it is more common in women, but men can also get rosacea. It most often occurs between ages 30 and 50, but it can progress after age 50. But typically, this onset is going to occur between 30 and 50 years old. So, one easy way to think of it, if you're 25 and under, it's very unlikely you're having rosacea, you're having acne. So this is one thing to think about, and keep in mind that it is more common in women. However, when men get rosacea, it is typically severe, and it can be one of the more uncomfortable types as well. You see rhinophyma and that thickening of the skin being more dominant in men. Hi, Brian. What type of acne is associated? So pustules, papules would be the acne that could appear like rosacea. Now let's talk about appearance. So with acne, pustules, papules, the redness is surrounding the actual breakout. With rosacea, you will see it more widespread, and rosacea typically disperses across the mid face, all through here. And again, it's when you see the redness, it's not just going to be surrounding the breakout itself. It's going to be kind of like a backdrop surrounding um, surrounding the area. Now, because these are pustules and papules, I do see a question about RF microneedling. My personal preference is to get it under control. Often RF microneedling companies, will tell you, yes, you can treat overactive acne. Yes, technically you can, but you are putting your patient at risk for skin purging. The best thing to do is to clear up their skin first. RF microneedling can have some beautiful results on erythema and sometimes even telangiectasia, with the heat component there helping heal those capillaries. But my advice with these papules, pustules, get the skin cleared as much as you can, um, please. So let's get into a little bit of skincare here. Both of these can be very sensitive issues for the skin, and often people with acne or rosacea will have sensitive skin, say they have sensitive skin, or their skin is just oversensitized. Usually, this is the issue. Not many people have actual sensitive skin, which is why it's really not even technically considered a skin category. It's normal, dry, oily combination. But our hydrating cleanser. This is going to be safe if you have acne or rosacea. It's not going to make it worse. And these will not strip your skin of the oils that you need, but will also give you that nice, clean feeling. This is completely vegan. This is DEA free, TEA, paraben free, dye free, gluten free. And it does foam up without water, but you can put it on first, and then add water to it. This is safe for your entire face. I use it over my eyes in the evening to remove my eye makeup. You can see that nice foaming result there. Smells amazing. Chamomile, marigold, oat kernel, really calming, great for that inflammation. And then, of course, you've got the hyaluronic acid, the green tea, snow mushroom, completely botanical cleanser. Definitely check that out in the store. I'll give you the direct link here, and that shopping code will save you a little bit of money. We do have this in 2 different sizes, so if you already love it, go ahead and buy that big 16-ounce pump. It's almost 5 times this size, and it's a great price point there. The other product I'm going to recommend is our pure hyaluronic acid serum, available in a 1-ounce size and a 4-ounce size. If you know you love it, just buy the big size. Our pure hyaluronic acid serum only has 5 ingredients, and this is something that will moisturize your skin and not break it out, especially if you have any one of these skin issues. Thank you guys so much for your participation. So let's talk about groups that can, have these skin conditions. Typically, rosacea itself is more common in like Celtic, Scandinavian backgrounds. But with that being said, melanin-rich skin, skin of color, anyone can get rosacea, and sometimes it is overlooked in African American, Hispanic skin. So you really need to stay in tune. Sometimes you do have to get a second opinion. Even though it's not as common, it can still happen. There is such thing as ocular rosacea, so feeling grittiness, bloodshot eyes, burning, watery eyes. You do want to see an ophthalmologist, get that checked out. There can be different levels of pain, stinging, itching associated with rosacea. There is treatment out there. So definitely, you do want to look into that. Same with acne. Seeing a board certified dermatologist is the best thing you can do. Estheticians can help with acne, but once you're really getting into that acne vulgaris, 4 and 5, I would definitely recommend seeing a board certified dermatologist. Thank you guys so much for all your participation today. I hope this video has helped you a little bit with noticing and understanding the difference between uh, pustular papular acne and papule pustule rosacea. So thank you guys so much. Bye guys.